The Early Warning System, EWS, is designed as an inter-institutional network that brings together key stakeholders to collaborate, share, and act upon critical information. The system aims to enhance authorities' abilities to detect and assess risks, allowing for timely alerts and decisive action where it matters most. At the launch, key stakeholders reinforced their commitment to a proactive and collaborative approach to safeguarding communities. Substance Abuse Advisory Council Secretariat Coordinator Natasha Lloyd Felix emphasized the importance of the system in protecting lives.
Coincidence that everything aligned so well for us from last year, where in May, the supply side of CCAD came to St. Lucia to do a 1-week training on new psychoactive substances and precursor chemicals, where many people who are in the room today benefited. It wasn't only to give us information, but we were shown, demonstrated how in a very small space with basic substances, we can generate something that could be toxic and life-threatening. And so we knew there's a reality out there that we needed to rapidly scale up our capacities to respond to.
The EWS aligns with the St. Lucia Fire Service's mandate to protect and save lives. Chief Fire Officer Ditney Downs highlighted the system's role in providing early alerts to potential hazards, enabling first responders to take timely action and reducing the impact of substance-induced illness or fatalities. Downs also pointed out that substance abuse often contributes to violent acts, road traffic accidents, and fires, further straining emergency services and exposing officers to traumatic situations.
As we launch these early warning systems, we appreciate the real benefits this provides for proactive and informed action and care as service is delivered by our team to our clients. From the information which will be gathered and shared by the various actions in the system, our agency will be better informed and more alert in the dispensing of our services. Most importantly, the opportunity for interagency communications of alerts and warnings will aid in stemming the potential risks of the changing landscape of the drug problem.
According to the Inter-American Drug Abuse Control Commission, CCAD, of the Organization of American States, OAS, the drug problem in the Caribbean remains complex. St. Lucia, a key transshipment point for cocaine and cannabis, faces an evolving threat with an increasing variety of drugs. CCAD Executive Secretary Adam Nam noted that St. Lucia's EWS is one of several recently launched in the region, alongside systems in Mexico, Jamaica, and Suriname. Nam warned that rising drug-related deaths in the US and Canada serve as a stark reminder of the risks facing Caribbean nations.
Of new psychoactive substances and opioids, such as fentanyl, have resulted in dire consequences for several OAS member states, particularly those in North America. These dangerous drugs are often mixed with organic drugs, such as cocaine and cannabis, increasing their toxicity and often without the users being aware. And this is a very important point. You don't know what you're taking.
He also pointed to a recent incident in Jamaica where over 60 primary school students required emergency care after consuming lace candy sold by a vendor. The event highlights the very real and immediate threats posed by emerging drugs in the Caribbean. In 2023, CCAD's multilateral evaluation mechanism reported that St. Lucia lacked a national EWES to identify new psychoactive substances or other emerging drug threats. Now, with the launch of the EWES, St. Lucia has taken a determined step towards addressing these risks. OAS Country Representative Lily Ching Soto echoed this sentiment.
About the first clandestine drug laboratory ever discovered in Trinidad and Tobago, where methamphetamine was being produced. And the Barbados early warning system issued 2 warnings on the discovery of methamphetamine and synthetic cannabinoids in that country's drug market.
The Ministry of Health has announced plans to further expand the system as part of ongoing efforts to protect lives, save livelihoods, and create a safer St. Lucia.